Which layer of the heart wall is responsible for the pumping action of the heart? A. Endocardium, B. Myocardium, C. Epicardium, D. Pericardium. And the correct answer is B. Myocardium. The myocardium is the layer of the heart wall responsible for its pumping action. It is composed of cardiac muscle tissue that contracts to propel blood out of the heart chambers. Which lifestyle modification is least likely to reduce the risk of heart disease? A. Smoking cessation, B. Regular physical activity, C. High sodium diet, D. Healthy diet. And the correct answer is C. High sodium diet. A high sodium diet does not reduce the risk of heart disease. It actually increases it. Consuming too much sodium can lead to high blood pressure, which raises the risk of heart attacks and strokes. Which non-invasive method is commonly used to treat narrowed coronary arteries? A. Coronary artery bypass graft, B. Angioplasty, C. Valve replacement, D. Heart transplant. And the correct answer is B. Angioplasty. Angioplasty is the non-invasive method commonly used to treat narrowed coronary arteries. Angioplasty is also known as percutaneous coronary intervention (PCI) and balloon angioplasty. This procedure involves using a balloon to widen the artery and placing a stent to keep it open, improving blood flow to the heart. CABG stands for A. Coronary artery bypass graft, B. Carotid artery bypass graft, C. Coronary artery ballooning graft, D. Carotid artery ballooning graft. And the correct answer is A. Coronary artery bypass graft. Coronary artery bypass grafting is used to improve blood flow to the heart in individuals with severe coronary artery disease. It involves grafting a blood vessel from another part of the body to bypass blocked or narrowed coronary arteries, thereby restoring adequate blood flow to the heart muscle. Which of the following medication is a common beta blocker used in heart disease? A. Lisinopril, B. Metoprolol, C. Amlodipine, D. Atorvastatin. And the correct answer is B. Metoprolol. Metoprolol is a common beta blocker used in heart disease. Metoprolol is used to treat high blood pressure, angina, and heart failure. It works by reducing the heart rate and the heart's workload, helping to prevent heart attacks and improve heart function. Echocardiography is primarily used to assess A. Structure and function of the heart, B. Blood pressure, C. Blood glucose levels, D. Both B and C. And the correct answer is A. Structure and function of the heart. Echocardiography is primarily used to assess the structure and function of the heart. It provides detailed images of the heart's chambers, valves, walls, and blood vessels, helping to diagnose and monitor various heart conditions. Which biomarker is most specific for myocardial infarction? A. C-reactive protein, CRP. B. Troponin. C. Brain natriuretic peptide, BNP. D. Myoglobin. And the correct answer is B. Troponin. Troponin is the biomarker most specific for myocardial infarction, heart attack. Elevated levels of troponin in the blood indicate damage to the heart muscle. Cardiac output is the product of which of the following? A. Stroke volume and heart rate. B. Stroke volume and blood pressure. C. Heart rate and blood pressure. D. Heart rate and systemic vascular resistance. And the correct answer is A. Stroke volume and heart rate. Cardiac output is the product of heart rate, that is the number of heartbeats per minute, and stroke volume, that is the amount of blood pumped by the heart with each beat. It measures the total volume of blood the heart pumps per minute. What does the P wave on an ECG represent? A. Ventricular depolarization. B. Atrial depolarization. C. Ventricular repolarization. D. Atrial repolarization. And the correct answer is B. Atrial depolarization. The P wave on an ECG represents the depolarization of the atria, which is the electrical activity that initiates the contraction of the atria, pushing blood into the ventricles. During which phase of the cardiac cycle does the heart fill with blood? A. Systole. B. Diastole. C. Isovolumetric contraction. D. Isovolumetric relaxation. And the correct answer is B. Diastole. The heart fills the blood during the diastole phase of the cardiac cycle. During diastole, the ventricles relax and the atrioventricular valves open, allowing blood to flow from the atria into the ventricles. Which arteries supplies blood to the heart muscle itself? A. Pulmonary artery. B. Coronary arteries. C. Aorta. D. Carotid arteries. And the correct answer is B. Coronary arteries. The coronary arteries supply blood to the muscle of the heart itself. These include the left coronary artery, which branches into the left anterior descending and circumflex arteries, and the right coronary artery. The mitral valve is located between which two structures? A. Right atrium and right ventricle. B. Left atrium and left ventricle. C. Right ventricle and pulmonary artery. D. Left ventricle and aorta. And the correct answer is B. Left atrium and left ventricle. The mitral valve, also known as the bicuspid valve or left atrioventricular valve, is located between the left atrium and the left ventricle of the heart. Which chamber of the heart receives deoxygenated blood from the body? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. And the correct answer is Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.